larger numbers than public health has had to deal with anything before or even previously with COVID.
That's a big deal. Yeah, they're talking about COVID testing. And because the Omicron variant spread so quickly, testing numbers are even worse than when Idaho's hospital systems were in crisis standards of care for the majority of the fall. Public health districts, including Central District Health, who you just heard from, which serves Ada, Boise, Elmore, and Valley counties, they say they're seeing record numbers. In December, processing around 700 to 800 tests a week. This week, the first full week of January, that number increased to more than 4,000 tests. We still got a few days left, by the way. That's already a 433% increase. So how does this number, these increasing numbers, impact your wait time for results? Here's Katya Stepovic.
During crisis standards of care in Idaho back in September, Central District Health was seeing close to 1,000 tests coming in to be processed every week. Believe it or not, today that number has quadrupled.
Our health district had 700-800 cases a week a few weeks ago. Now, for the first week of January, we're thinking we'll be close to 4, which will be our highest ever in the COVID pandemic so far.
Or what?
4,000 cases.
Yeah.
Yep.
Wow.
CDH, which oversees Boise, Ada, Elmore, and Valley counties, is being flooded with recent demand for COVID results.
Right now, we have about 200 labs to review still from 2021 to determine if they're cases or not, and about 5,000 so far from 2022.
Lindsay, program manager of the Communicable Disease Program, says about 90% of the tests that come in are positive. And with all the tests that have yet to be processed, get comfortable while you're waiting.
When we start seeing so many people seeking testing and so many labs having to be run in our area, but across the nation, that the labs also have a backlog, and instead of having a test result within a day or two, it can be 3 to 5 days. And now when we're looking at that period of time for people needing to isolate or quarantine, we're out of that by the time they're receiving test results.
Are most of these test results within a certain age range of people, or what are you seeing most commonly?
We are seeing it impact everyone across the board. So all age groups, all areas within our jurisdiction are being impacted.
Because of the backlog, CDH has prioritized certain phone calls, meaning less people will get called and more will be navigated to find results and information online.
It's been tough to keep up, so we're making adjustments to our process to do the best we can to stay on top of it. It's seeming a little bit insurmountable right now.
She adds that based on clinical samples and wastewater testing, majority of the test results are Omicron positive. So if you have a simple inkling that you may be positive, isolate while you wait for your results.
We're all tired. Even in public health, we're tired of hearing it. We're tired of dealing with it, but it's not tired of us yet.
Okay, so that is from Central District Health, Katya, that you spoke with today. What about the other public health districts around the state?
Well, you would think that they're saying really the same thing, but according to Southwest District Health, they have no backlog, so results are taking anywhere from 1 to 2 days. But they did say in the last week alone, testing has increased by 50%, so double. South Central Public Health is experiencing also longer wait times, and they say they're assisting everywhere that they can, but that it's really difficult to get extra test materials to fill that need.
One of the biggest issues right now, too, are those testings, those at-home kits, those free testing kits. Those are few and far between to come by out there. All right, thank you very much, Katya.